Hi, my name is Michael Osofsky. I'm a board-certified dermatologist and pediatric dermatologist. What this means is that I did an extra year of training in pediatric dermatology after completing the usual 3 years of general dermatology training. I decided to do the extra year of training in pediatric dermatology for the simple fact that working with kids is incredibly fun and unpredictable, and makes my day go by much quicker, that unpredictability. In addition, I really enjoy trying to help parents with babies that are a week old and sort of reassure them on various growths or rashes that they have, because I know when parents see things on their children's skin, it can be a very scary thing, typically more so than an ear infection or a general cold. When parents see rashes or growths, they're worried. So I know when I see them, I can really try and help them with their concerns and help their child get better. I grew up in Long Island, New York, but have since moved all across the country. I spent time in South Bend, Indiana at college at the University of Notre Dame. I then went on to Georgetown University in Washington, D.C. for medical school. From there, I went to Pittsburgh for my internship. From there, I went to the University of Iowa in Iowa City for dermatology. And then finally, I went to San Diego, California for pediatric dermatology. I'm now happy to call the Fox Valley my home, where I have a 1-year-old son and a new baby on the way. My wife and I love it here. We came here because we really appreciate the Midwestern values and for the great winters that we have here. In my free time, I like spending time with my son. I have 2 dogs, an English bulldog named Snuggles and a poodle named Spike. I love to cook, everything from homemade wood-fired pizzas to homemade pad thai. What I love about dermatology and pediatric dermatology is that everything I do is basically trying to improve somebody's quality of life. We don't generally deal with too many life or death situations. However, people seem to be a lot more affected by what's affecting their skin that they can see, in contrast to things like blood pressure or things like that that's on the inside. So I know when I'm treating somebody and making them better, I'm really helping them enjoy their life better. So that's why I really love dermatology. One particular patient that I remember that really impacted me was a little 1-month-old baby who was born healthy, but a few weeks of age developed a growth around her nose. And then at about a month, she couldn't breathe, and she went to the emergency room because of this breathing difficulty. We diagnosed her with a hemangioma, which is a blood vessel growth that's very common in kids, and started her on a medicine that helped her shrink this growth and allowed her to breathe and develop normally. She's now probably about 1.5 years old and doing great. My name is Dr. Michael Osofsky, and I look forward to caring for you and your family. Remember, if you're bringing your kiddo to see me, tell them they're coming to see Dr. Mo.